my name is Kavita Sao and I work at Counseling and Psychological Services at the University of Central Florida. I'm here with Dr. Jamie Bourn, one of the therapists here at UCF.
Thanks. Yes, I'm Dr. Jamie Bourn. I'm one of the licensed psychologists here at Counseling and Psychological Services.
Today is World Mental Health Awareness Day, and this year's theme is suicide prevention. I'm here with Dr. Bourn to have a conversation about our transgender community and suicide prevention.
Yeah, this is a topic that's really near and dear to my heart because I work a lot with the transgender community. So I work with the community in individual counseling. I run our trans and gender diverse support group here at CAPS. And I also identify as part of the transgender community. So I identify as non-binary trans, and I use they, them pronouns. So this is a topic that's really important to me, and just before we met today, I was actually looking at some of the statistics from the 2015 US Transgender Survey, which actually showed some pretty staggering statistics to me. So one of the things that really stood out was that out of 27,000 respondents, 40% had reported a lifetime suicide attempt, which is 9 times the national rate, which is just alarming and just very sad.
So how important is it that when we are given somebody's pronouns that we actually use what we're given and we don't just make up pronouns?
I'd say it's really essential, honestly, because first it's validating a person's experience more than anything. So I think about my own experience. Sometimes people use my pronouns, sometimes they don't, and I know that I feel just supported and affirmed and validated when they do use them, and it can help me to know that that's a caring and supportive person. And back to those statistics that I had just mentioned, when a person doesn't use them, I think that underscores some of those statistics. And we also know that the trans community is more likely to experience things like violence, homelessness, job insecurity, negative family experiences. So those external forces that they experience underscores a lot of those psychological issues and the suicide rates that we see. So it's those external factors that contribute to those internal experiences.
Okay, so in addition to using someone's pronouns that they give to us, what else can we do to support the transgender community?
There's a lot, honestly. So I think being a supportive, kind, and caring person is always the first step. Along with that, a thing that plays into that is educating yourself. For example, here at UCF, we do advocates training, which is a way to figure out how to be a caring and kind person to the trans community, but also the LGBTQ plus community as a whole. And then it also tells you how to figure out how to use your voice for a force of change within the community or for the community. So there's an empowerment piece. Part of it is figuring out what your spheres of influence are, so how you can use your voice for good. I would say that we have more power than we often think, so a lot of it comes down to having conversations with people. So when you hear negative messages, so with family, with with people in your life, when you hear myths about the trans community, it's speaking up and saying something, correcting those messages. When you hear someone being bullied, really not allowing that to happen, that's a lot of it. And then honestly, another big piece is remembering the power of voting. Like that can really make a big difference. So sometimes we feel like our voice doesn't have power, carry weight, but it really does in many different ways, and that's a big piece that really can carry a lot of weight.
Okay. All right, that's all the time that we have for today. Thank you so much.